Hi, I'm Devina Savant, and I'll be presenting my study, Association between Food Insecurity and Developmental Delay and Behavior Problems in Children 2 to 5 years of age. At the time the study was conducted, I was a fellow in developmental medicine at Hasbro Children's Hospital. The study was funded through the HRSA Maternal and Child Health Bureau training grant. I have no other disclosures. Food insecurity is a condition closely linked to, but not entirely defined by poverty. Although families often attempt to safeguard their children from significant reductions in food intake, more than half of the households that reported food insecurity between 2017 and 2020 on the US Department of Agriculture survey had at least one child that was also food insecure. Trends in food insecurity have fluctuated in recent years, with provisions such as the extended SNAP, the Supplemental Nutrition Assistance Program, also known as food stamps, and expansion of the child tax credit benefits provided by the American Rescue Plan Act of 2021, the US saw a decrease in household food insecurity during the pandemic. However, as these federal safety nets were rolled back at the end of 2021, the household food insecurity rate has trended back up to pre-pandemic levels. Our study focuses on the time between 2016 to 2017 and thus provides baseline information between the relationship of food insecurity and developmental and behavioral outcomes in young children. We analyzed data from the National Survey of Children's Health 2016 to 2017. An adult in each household answered questions about the physical and mental health of a single child that was chosen by random selection as the subject of the survey. Food insecurity was coded as present for households that responded that they sometimes or often experience decreased food intake or ate foods deficient in recommended nutrients, and was coded as absent in households that always had safe, nutritious, and sufficient food available. For our outcome measure, respondents were asked if they had ever received a diagnosis of developmental delay or behavior problems by a doctor, healthcare provider, or educator. Our final sample included 14,464 children with valid data for the exposure and outcome variable out of over 70,000 surveys that were completed. Moving on to a bivariate analyses, we found that food insecure children were more likely to be non-Hispanic Black or Hispanic White, more likely to be publicly insured, from single-parent households with caregiver education of less than a high school diploma, with family income at or below 130% of the federal poverty line, more likely to receive SNAP benefits, and overall more likely to be diagnosed with developmental delay and behavior problems. This is a forest plot depicting our adjusted model. After adjusting for age, sex, race, ethnicity, caregiver education, family income and structure, children in food insecure households were 1.57 times more likely to be diagnosed with developmental delays and behavior problems as compared to children in food secure households. Older children, little boys, and children from households with single mothers were also more likely to be diagnosed with developmental delay and behavior problems as compared to younger children, little girls, and children from two-parent households. Interestingly, we found that children from other non-Hispanic race and ethnicity were less likely to be diagnosed with developmental delay and behavior problems. In identical adjusted models, excluding poverty and insurance status, homes not receiving SNAP benefits maintain this association between food insecurity and diagnosis of developmental delay and behavior problems, while in homes receiving SNAP benefits, this association was not significant. In conclusion, in this population-based survey of children 2 to 5 years of age, children from food insecure homes were significantly more likely to be diagnosed with developmental delay and behavior problems as compared to children in food secure households. When stratified, there was no association between food insecurity and developmental and behavior problems among those receiving SNAP benefits, while the association remained for those not receiving SNAP. Data from the pandemic, when federal safety nets were cast wider, show that these protections can be extremely impactful in providing food security and decreasing child poverty. It is imperative that we review and revise policy proposals such as expanding SNAP and financial assistance programs to support good nutrition for vulnerable families. Thank you for listening.